Hi, I'm April Norris. I'm going to be sharing just a bit of my pediatric BSN curriculum. First, I'm going to talk about my BARC assessment results. As you can see, I am very heavy on the kinesthetic and oral. I learn best by doing and hearing. So what that meant with my presentation is that my slides are more for reference, more going to be for my words and my descriptions. I'm not going to be reading my slides. It's going to be more verbal expressions using scenarios. I can't just go by what my learning style is. I also have to think about my students. And since this would be a pre-class video for them in a modified hybrid, I'm going to have to basically give them the foundation. Those that are divergent, they're going to use it, what they learn with these to be able to use in the classroom when they brainstorm, since they learn that the best that way. Those that are assimilators can use the textbook. Convergers have the pictures and the diagrams, and then the scenarios are really going to help out the accommodators. Every student has to take this class, and so I tried to look and see and make sure that each learning style is going to be have something that they can get out of my presentation. And really, with the visual oral reading and then even the kinesthetic, they're hands-on, but the scenarios help them to think through things and how they would do it. So really, I'm reaching all the learning types. So I'm going to go ahead and go right into my presentation. This is Nursing 3823. We are talking today about hematologic conditions in children, specifically sickle cell. Remember that the blood is made up of different types of cells. Red blood cells is one part of them. They're called erythrocytes. Why is that? It's because the kidneys stimulate the production of them when they secrete erythropoietin. It's a hormone that tells the bone marrow, hey, you need to start making some red blood cells. So that's where they got that name, remember. They've got a concave round shape because they have no nucleus. They're easy to squeeze through vessels, have a 120-day lifespan. Their function, what is it? They're the truckers of the body. They're going to transport oxygen from the lungs to any place in the body that needs it. And then they're going to pick up the CO2 that the cells have given off and take it back to the lungs where it can be expelled. That's all done through hemoglobin. That's what this is right here. It's a hemoglobin molecule. This is a hemoglobin A. It's a normal hemoglobin. They use these little proteins and binding. They bind with oxygen to hold on to it. Hemoglobin S, or the sickled cell hemoglobin, sickle, that it changes the shape of it so it doesn't hold on to the oxygen quite as well. We'll talk about that later, along with hemoglobin F, which is fetal hemoglobin. That's the one that we have at birth. It starts dropping off and they stop producing that around 5 months. The key thing about that is that it does not sickle. So what is sickle cell? It is an autosomal recessive disease, which means you have to have two parents that have the trait. They may not have sickle cell, but they do have the trait. And so they get together and it is expressed within their child. The most common ones that we think about is African Americans having sickle cell disease. However, Hispanics, Middle Eastern, any of those that have a descent that's basically around the equator, those that have sickle cell are kind of protected from malaria. And so those are the kind of civilizations that we see with that. It's not just an African American disease. There's over 3 million in the world that have it, and it's caused from a mutation in their DNA. There is a glutamine, or I'm sorry, where there's supposed to be a glutamine, there's a valine. And so what that means is that it changes the shape of the hemoglobin. So instead of being on its own, a nice little structure that picks up oxygen, we've now got this structure right here. When there's a decrease in oxygen, it changes its shape and makes these nice little hydrophobic regions that kind of cling on to another hydrophobic region of another one, and they make these long chains that become these rods. This is called an hour rod. And these rods kind of make up the shape of these. You can almost see, imagine rods in here. Because the red blood cells made of so much hemoglobin, it kind of takes on that shape. And so then they start sickling. Well, as we talked about it, hypoxia. Decreased oxygen is what causes this. It can be caused from infection, like pneumonia. It could be caused from playing outside too much and exercising. You get dehydrated. You're exercising. You're going swimming. That fluid's being pulled off you. You kind of get sludgy blood because you don't have as much fluid going through there. Also, it's been shown that extreme temperatures, when at 9 o'clock it's 40 degrees, and then at 2 o'clock in the afternoon, it's 92. Alabama's a prime example. Those extreme temperatures, that's when you really see a whole bunch of those pain crises. That the shape of that hemoglobin changes. They don't have as much oxygen going through there. They drop their sats. They live at a lower hemoglobin, usually between 7 and 8, some even 6, and their body just is used to that. Because of these and because of the shape of it, the red blood cells are more fragile. They're breaking up more easily. So we've got increased hemolysis. So what's going on? We're getting more sludgy blood. We're having more occlusion. We're getting jaundice. And then that causes anemia, which causes more sludgy blood. And you're just getting a big cycle with it. With sickle cell disease, that vasoocclusion, you can see those sickled cells, they don't go through the vessels very well. They get stuck. They get stuck in little joints. That's where you're having lots of pain. So you have the occlusion pain, and then distally from that, you have pain from hypoxia. Causes all kinds of diseases. One of these is dactylitis. It's where you have sickling within the joints of the fingers and the toes. This used to be the way that you found out that your child had sickle cell. Now we have newborn screening, and so they don't find out about it like this as much. But it's usually between 6 months and 2 years. Why is that? Think about it. That fetal hemoglobin goes down what time? About 5 months. So what's coming up? As that's coming down, the sickling hemoglobin's coming up, and a lot of times 2 o'clock in the morning, that baby wakes up just screaming, can't figure out what. You look at those hands, they're all swollen up because we're having our first sickle cell crisis. So fluids, pain management, want to make sure that there's not something else going on, so you have to treat for fevers. Priapism is another big one. A lot of times in prepubescent and adolescent males, sometimes 6-8-year-olds as well too. But it's a prolonged erection greater than 2 hours. Now, what's the big thing about this? How many 13-year-olds do you know that wants to go to their mom and go, hey, mom, something's going on down here? Not very many. But keep in mind, this has nothing to do with arousal. This is completely due to vasoocclusion. You're having occlusion of those vessels. So blood's getting trapped and then can't get out, and new blood can't get in there. So we're losing oxygenation with this too. And the longer it goes on, the more likely there is for complications in the future. Sexual dysfunction, and all kinds of things. Heat packs, Sudafed to kind of vasodilate and help with that is what kind of the first line treatment. But if it's been going on for a while, a lot of times, and I know all you guys are going to groan, a lot of times they got to use a butterfly, and they have to get in there and actually express blood straight from the penis. And sometimes they will have to inject a smooth muscle relaxant right into the penile muscle tissue. We're going to move on before all of my boys, my guys in the class kind of fall out from that one. Another one's splenic sequestration. What's the spleen do? It's kind of a filter. But what happens when you've got blood cells that are getting stuck in that filter? Well, you're going to have blood fill up that spleen. They're going to have abdominal pain. You keep giving them blood, but their hemoglobin and hematocrit's still low. A lot of times they have to have a splenectomy. And one thing to remember when you have a splenectomy, you don't have that coverage to filter out that bacteria anymore. So they're very prone to encapsulated organisms. So they have to be on penicillin for life. Acute chest syndrome, there's a triad. Fever, hypoxia, infiltrate. What's that sound like? Sounds a lot like pneumonia. And a lot of times that's what it starts out as. They'll come in, they've had a cough, they got stuck in that rain or those weird temperatures. A little bit in here, so we'll give them some antibiotics, and then it starts to grow and grow. And these are the ones that they're having chest pain, they're having shortness of breath, increased work of breathing, increased oxygen requirement. When you're having that key with acute chest, you're going to stick some oxygen, get those antibiotics, pain management with opioids. Evidence-based practice has shown you're going to transfuse them to try to get their hemoglobin up to 10 when they're having an acute chest event. Stroke, the biggest thing with that is we're having them on opioids because they are hurting. And so we need to make sure that we're assessing to make sure that some of the sleepiness, the hallucinations or disorientation that might happen with morphine, that we're not having that because something else is going on. So just make sure that you are diligent about those neuro checks, the grip strengths, level of consciousness, and all of those kind of things. Again, nursing interventions, incentive spirometry, every hour while they're awake if you can. Smaller kids, get them to blow bubbles. All right. Prophylactic penicillin, because of the newborn screens, they now start them on penicillin as soon as they find out about that. It's increasing their lifespan because they're decreasing in infections. Pneumococcal vaccines, hydration. We want to make sure that they're getting educated to stay rested. When they're at the pool, make sure that they're drying off so that as evaporation is coming off of them, they're not pulling more water out with them. Prevent illness through hand washing. Hydroxyurea is a medication that increases the production of fetal hemoglobin. Why is that important? Because it doesn't sickle, exactly. Chelation therapy helps to take out some of the iron that's left behind when we're having all of that hemolysis. And then there is research going on with stem cell transplantation. So let's think through some of these things, okay? We've got an 8-month-old boy. He's got pain, hands, joints. What are we thinking? Dactylitis, that's right. So we're going to assess for perfusion, monitor for fever, use heat packs. Don't ever use cold packs. We want to vasodilate, not constrict. He should be on daily penicillin, and we're going to use pain medicines. Number 2, we've got a 13-year-old comes in complaining of some right arm pain. Then starts vomiting. Then starting to talk about headache and maybe some left arm pain and some numbness. What are we thinking about? Stroke, exactly. Be monitoring for that. You're going to do a full assessment. You're going to be looking at that cognition. Make sure that you let that doctor know immediately so that we're doing neuro checks. We're doing those grip strengths. Is one greater than the other one and it was fine before? Baseline is really important in these kids. And then we're going to look at it with a CT or an MRI, and we may be sending them to the ICU. We've got a 15-year-old. She'd been on a PCA, pretty good dose of the PCA and everything, kind of controlling her pain. Well, you go in there, maybe do midnight vitals or so, and just can't get her to wake up real well. Respiratory rate's 10. Her O2 sats are 88%. Is she doing a stroke? Could she be having a acute chest? Maybe. That's where your assessment comes in. For this one, she's in pain crisis. She's just gotten really, really sedated from that morphine. And so it's important to have a baseline. It's important to know your neuro checks. Put some oxygen on her. Let the doctor know. Get a chest x-ray. Make sure that we're not going into acute chest. We may need to wean the morphine. We may need to go down on it. Biggest thing, we're going to be doing more frequent vital signs. And what else are we going to be doing? Incentive spirometry. Right. Good job. 8-year-old comes in, admitted for abdominal pain. Bells and whistles should be going off in your head. Increased pain. We gave him some blood because his hematocrit was a little low. Now his heart rate's 160. Our O2 sats are 88%. What are you thinking? That's right. Splenic sequestration. Good job. Assess those lungs, your abdomen, your perfusion. Let that provider know, hey, we've got some excess pain going on here. I can't even touch his abdomen because the kid doesn't want me to touch it. Get a CBC. The hematocrit and the H&H is 5 and 16. We just gave him blood. What's going on? It's filling up that spleen. So probably going to have to take it out. Going to get a CT with that. And then what are we going to have to make sure that they do? Penicillin for life. Last one. Here you go. 8-year-old, not same kid, but sounds a lot like him. Comes in with some arm, shoulder pain. Okay. Now you go in to assess them and they're like, my back's hurting. My other arm's hurting, and you notice they're breathing a little heavier, working a little bit harder, maybe pulling, and their heart rate's up. What are we thinking? Acute chest. That's right. So we're going to do an assessment of the lungs, perfusion, stick them on some oxygen. Let that doctor know. We need to get a chest x-ray, see if we're getting. So what's the paramount that we have to do with that? That's right. We're going to get them up to a hemoglobin of 10 so that we can transfuse, so we can get more blood going to them than just the sickling blood. It's going to carry that oxygen in there. And sometimes they need supportive care in the ICU. What's that prevention that we need to be doing? We need to be doing that incentive spirometer, giving them antibiotics, just like we've talked about.